Hello! Oh my gosh. This is Dr. Tamisha Denis of The Modern Smile, and this is my first YouTube Live. I am so excited. I wanted to come back to YouTube not just to go with my traditional videos and everything like that information, but I also wanted to make sure that I took the time to answer the comments and all the questions. And I'm so happy about the questions and comments that I got on my first video back from YouTube. And I told everybody that I had been gone for 2 years. So please forgive the lighting. I'm still kind of working on, I'm in a new space compared to where I was 2 years ago, and how I've changed over time. But I'm in a new space. I'm still trying to figure it all out, but I didn't want to lose the opportunity just to thank everybody from coming on live. So if I don't do this exactly perfectly, please forgive me. I'm going to try to do this every Tuesday. That's when I have a little bit more time away from the office, and then that way I can answer some of your questions. So if I don't see what's happening and all that stuff, please forgive me. Anyways, so first of all, I wanted to give a couple of shout outs to some people who congratulated me on coming back to my YouTube channel and asked questions. So I'm going to jump right into it. Sorry, I don't know if something happened. I'm going to jump right into it and get right into answering the questions and comments. And I'm hoping that as I start to do this, that more people will be more involved in kind of seeing that I'm going to be answering any of your questions and comments that you make on every video that I make. But I'm still going to try to do all the videos. So, like I said, please forgive me. First of all, I wanted to make a shout out to Modern Art. She is a dental hygiene student that was using our videos to help kind of fill in the gaps of her education. And I encouraged her to let me know. So hello out there. I just wanted to let her know. I know I made videos about counting tooth numbers and stuff like that. Believe me, there's a lot more where that came from. So if you want to have more information, if you're a dental hygiene student or if you're in dental school and you just have some questions about just regular dental stuff and you want the answers to it, I can make videos about it, or I can actually also do, oh, somebody's saying something. Can you get braces with missing teeth in the back? Absolutely. Now, I'm going to make sure that I keep all of these questions coming, but can you get braces with missing teeth? That's a little tricky one because I have a lot of patients who either have missing teeth. I'm actually in the middle of a case right now because I do clear braces or Invisalign type braces, but I have a lot of people who they need implants in the future and they want to move their teeth around first. And so what I tell them is we do a variety of two things. Number one, we will straighten your teeth or be actually in the process of straightening your teeth either with your orthodontist or with me. And then somewhere, let's say the middle to end of the procedure, we'll either place the implant and then wait to put the crown on, because implants do not move. So you want to make sure that you have your teeth in the place that you want them before. Now, if you're asking this question because you have missing teeth that you don't want to replace, that's tricky too, because depending on how many gaps or spaces or crowding you have, that space might be to your advantage. Maybe that space is going to help move some crowded teeth into a place that they weren't otherwise. So can you imagine if you have a lot of bunched up teeth right here and then you have a missing tooth in the back, that might be to your advantage to be able to push those teeth out without having to extract anything. Or when I start talking about Smile Direct Club and some of the challenges related with that, then I'll explain how the the limitations to Smile Direct Club, because you don't actually see a dentist. So that's definitely possible. I can go through in a video that's probably more appropriate than a live setting what it's like when somebody has missing teeth and they're also going through ortho. But there's no reason that you can't. Now, if you have gaps or spaces and you have a space, it's really important to fill the tooth back in, because if you don't, teeth are always going to shift. Once upon a time, they used to tell people, okay, 2 years after you finish your braces, you can wear your retainer and then you don't have to wear it anymore. That is not true. That is far from true. Actually, you have to wear a retainer for the rest of your life, and the people who don't, they end up getting braces again, and usually with somebody like me, because so can you imagine spending a couple $1,000s and having to do it again? It's kind of nuts. All right, so the next question I had is someone was asking me about dentine ice and about chewing gum in general. And I made a video about this. Actually, this was one of my first videos a while ago about chewing gum. Gum contains, sugarless gum that contains xylitol is actually good for you, because not only does it increase your salivary amount. So just people with dry mouth, they will tell you they get a lot more cavities, they have a lot more dental issues. So when you chew gum, sugarless gum that encourages your saliva to flow, what's going to happen is that you're going to cleanse your mouth. So yes, of course, brushing and flossing, you must do it. But when you have saliva in your mouth, your body is self-cleansing. It's taking away the food. It's making you swallow. If you've ever taken allergy medication, had really dry mouth, boy, that's a doozy. So you want to make sure that you increase salivary flow. It also increases things like calcium. Hello. Sorry, I have to look up close. I need my glasses. Hi, how are you? So if you have things that increase your salivary flow, that's going to help. Also increases things like phosphorus. It increases things like calcium in your mouth. Not the gum itself, but just all the minerals that are already in your saliva to help to rebuild your teeth. And because our teeth are always going through a demineralization and a remineralization process. So because acid is really the enemy. Another thing that the gum does is sticks to all the bad things in your mouth. So gum is good if you can't get to brushing your teeth, especially sugarless gum, and it actually helps to fight the cavities, kill the bacteria that causes gum disease, the bacteria that causes cavities. So there is so many benefits to chewing gum, sugarless gum. Obviously, my house, I have 2 children, is filled with candy right now. Like literally, I cannot get rid of it fast enough because my kids, they went to trunk or treat and then they went to something else. And I just saw a comment. They went to something else, and you know I have so much candy in my heart, so in my house. So you have to be really careful about gum. Choose sugarless. Someone just made a comment about, and I didn't get to read it fast enough, so forgive me, about being in dental school. I know it's really hard. I sometimes joke that I would rather change professions than to go back to dental school because it's so tough. And they're hard on you because they want you to come out and be a good practitioner. Someone asked about, I need to learn, please forgive me everybody, I need to learn how do I view the comments as they're happening. No, that's not how you do it. If you don't mind putting your comment again, I would love to read it and get back to you about closing your gaps, I think that they said. In terms of closing your gaps, gaps are probably the most predictable thing to do in dentistry in terms of orthodontics. If you have gaps in your teeth and you want to close them, doing Invisalign is like a slam dunk. It's a slam dunk. I have a lot of people, oh, there you are. What do you do to recommend for front teeth gap? I've had bonding twice in the last 15 years and it always comes, okay, I literally had a patient, we just did it like last week, and she had chipped her front tooth as a kid, and it was like almost like a diagonal slant, and she chipped it and she just kept breaking it, and I kept fixing it, and I told her the smaller the chip, actually the harder it is for it to fix. Now it's a little extreme what I'm about to say, but sometimes a crown is the best option. If you don't want to spend time in the dental office over and over again, you gotta get a crown or a veneer. I know it sounds expensive, it sounds extreme to drill your tooth down just for a chip, but if it bothers you enough and you don't want to keep repeating, I'm gonna be the first person to sign up when they come up with some solution, just add a little bit and that's it. They don't stay. About anything you do is gonna chip that sucker off. So you just go like this, pops off. Eat something, pops off. So if you never want to eat corn on the cob or apples again, you might need to get a crown or a veneer. I don't know, talk to your dentist about it. There are multiple benefits to doing something like that because it's permanent. Everything else is temporary. I had another really good question about xylitol. I'm sorry, I answered that question. Halcyon for sedation. So obviously we have so many people out there who are so afraid of the dentist, and one of the ways that we manage that, and I have a whole video about that too. I have a whole video about if you're scared of the dentist, is the whole idea of taking oral sedation medication. Now, everything has risks and benefits to it. If you take oral sedation, the negative thing about oral sedation like Halcyon, which is in the same family as Valium, so it's just an anxiety medication. It is not going to numb you. You still have to get numb. You are still going to be awake to a certain extent. I've given people a Xanax and they're asleep, knocked out. And I've given people a Xanax and they are bright-eyed and they know exactly what's going on. Some people get a little amnesia though, even though they think that. Something like Halcyon is pretty strong. If I give a Halcyon to a patient, they usually are out like a light. Now, of course, there are some medical conditions that that's not the best way to go. And as you can see, I'm a talker. So most of my patients, I can talk them in or out of things. I talk to them about relaxation. I tell them how to breathe. I tell them what to do. I give them confidence in me so they're not as afraid. But it's really, really important important for you to know what you're gonna get out of that medication. If you're expecting, you don't need to get a shot because you have a Halcyon, that doesn't make any sense. But Halcyon is one of the stronger, I'm very reluctant to give Halcyon, but one of the stronger medications. I really love laughing gas. Most people love laughing gas. There are some people that get laughing gas and they think it's way too much for them and they're not interested in it. But for the most part, laughing gas is pretty freaking awesome. And laughing gas on a kid is like magic. I had a girl, she just cried and cried. She was about 11 years old and I had to pull a tooth on her, which I hate. An adult tooth on an 11-year-old girl, believe me, my dental heart was breaking. And I could negotiate the heck out of her. She would not sit still until finally we gave her laughing gas. She was giggling, talking to her mom. I have other kids I can give you stories upon stories of people who laughing gas made a huge difference. I have some patients, they will not even get a cleaning without laughing gas. So laughing gas, when you're done with it, because it's only inhaled, when it's done, it's done. How do you fix small spaces? I might need a clarification on that question. How do you fix small spaces in the front teeth and gaps? You can absolutely do bonding and not necessarily do a crown or a veneer, but you're gonna be committed, like I said before, if you do ortho, then it's done, right? But if you do bonding or something like that, you kind of have to be committed to the fact that you're going to always have to be careful. Right? So you're always going to have to be careful when you go to eat something. And there are some things in your mouth you can live with a long time. You can live with a long time without changing it. I have people who have pains and all kinds of things, and they just avoid that side. But at some point, you're going to decide, I would love to be able to chew on my right. I would love to be able to eat on that side. I'm sick of that thing filling up with hole. So if you have a small space with a gap, I definitely wouldn't want to drill your whole tooth, but you may consider that it makes a lot more sense for you to just do a simple bonding and be a little bit more careful. I always tell everybody in dentistry, sorry, I'm trying to flick these things away. I always tell everything in dentistry can be fixed. Everything in dentistry can be fixed. It just depends on how much money you're willing to spend and to what extent you're willing to go. So if you're willing to do that, hey, you can get about anything done. So if you have a small bonding, you don't worry about flossing it out or biting on the wrong thing, then fill it in with a bonding. If you want kind of more of a permanent fix, then you might consider doing a crowner, depending on the space or what it looks like, or doing some orthodontics, which is a little bit more of a permanent fix because you're not actually adding anything to your tooth. You're just squeezing the spaces together. I have some shout outs for some people who did security at the dental school that I went to, which I think is freaking amazing. That was a long time ago. And then I have Mega Hips. Says welcome back, thank you for that. Benjamin Brown, I just wanted to say that was my gum question and my Halcyon question. Shout out to Lucy and Cash. I just wanted to say shout out to everybody. Mind you, if you don't want me to shout you out in the future, I won't. And then shout out to XCX23CWEA that says welcome back and that they miss me. And I think that's everybody. So I'm not gonna keep these sessions really long. I'm gonna keep them moderately short. If you know anything about me, if any of you guys are my patients in real life, you know I am a talker. I can talk forever. I love to engage. I love to interact. And like I've said in my previous videos, I'm a little bit of a different dentist. I will draw things. I will tell you in any different way that you need to help you to understand what you need. And I always try to empower my patients. And I say, oh, I would love to see you. You want to come to my office? I would love to meet you in person. We're in Coral Springs, Florida, just to let you know. Anybody who's interested, I think in my info, I have that. But I'd love to meet people. I mean, sometimes when people meet me, they're like, are you going to be the same in real life? And I absolutely am the same. This is me. You're in Miami, you definitely can travel to us. I've actually had people, I have a patient, she travels from Key West. She travels from Key West to see me. Her mom lives in Coral Springs. She used to live in Coral Springs. So just a shout out if anybody wants to know. Somebody's asking me about my address. My address is in Coral Springs. It's 10196 West Sample Road. I'll put it in the description. I'm not sure exactly how this live stuff works, so please forgive me. And listen, to all the people who have a problem with my lighting and all the editing and stuff that I do, you have to remember I'm a one-man show in Homestead. You can come here in Homestead for sure. Homestead is far, but you could get here on a non-traffic day in less than an hour. I'm not a video editor. I do all of this stuff myself. I still work full time. So me even squeezing this into my day, even me squeezing this into my day is a little bit of a squeeze, but I want to make this a regular thing because I know lots of people, they live in different states and stuff, and they just have questions and they just want to feel better. They just want to know that what their dentist is telling me, I'm in Florida, what their dentist is telling them is legit. Because some people, I don't know how us dentists got such a bad reputation for being sneaky or deceiving. I mean, I'm one of those people, I'll take a picture of your tooth and I'll show you. I'll show you the x-ray. I'll explain it to you. Some people just don't, some dentists say, hey, you need a crown, goodbye. Right? And when you do that to people, they don't have a lot of confidence, especially I have so many people have bad experiences. Thank you. I'm new to this channel. I'm praying I pass this class in dental assisting and I'll be to this page. If you have any questions and comments about dental assisting, please let me know. Please let me know, because of all the things, when you're in dental school, you don't have a dental assistant. So we know how to do all of this stuff by ourselves. We're holding sections and all of these things. So if you have any questions about the topics in dental assisting, we'll let you know. So somebody was asking about tooth sensitivity. Oh, that's a tricky thing. I have a video about that too. I didn't realize how many videos I've made. So tooth sensitivity is, you have to be careful that you have tooth sensitivity because you have truly tooth sensitivity. It is called dental hypersensitivity. That means there is nothing otherwise wrong with your teeth that you have sensitivity. Now, let's say you're a true dental sensitive. That means that you can use something like Sensodyne, which actually works. Sometimes I even tell patients to get a cotton swab, like a Q-tip, put the Sensodyne on there and rub it into your teeth. These people, man, they have made so many new sensitive toothpaste. I can't even keep up with them. Like even Sensodyne has like 100 different brands, but they all have the same anti-sensitive ingredients in them. So that's if you're truly dental sensitive, use Sensodyne, okay? Now, if you are somebody who hasn't been to the dentist in a while, in New York, I went to school in Philadelphia. I wish I was up there too. So if you haven't been to the dentist in a while, you need to make sure that your dental sensitivity is just sensitivity and you don't have a cavity, you don't have a broken tooth, you don't have gum recession, which is the #1 cause of sensitivity. I saw a commercial about Sensodyne the other day, and then they were like, oh, #1 reason that people have sensitivity is it starts at their gum line. Yeah, it starts at your gum line because some people are brushing too hard. I joke with my patients all the time. I said, that hard toothbrush is for the toilet. It does not belong in your mouth. You should be using a soft or medium toothbrush, or you'll make your gums recede. You'll put divots in your teeth, and that junk is sensitive. And it's sensitive because you're exposing your roots. Now, there's things that we can do to cover those roots up too that doesn't involve just Sensodyne. But you got to make sure that it's really just sensitivity and it's not something else. I used to argue with a patient. She's like, oh, I just have sensitive teeth. I just have sensitive teeth. I'm like, I hope you take my insurance. We have in-house dental discount plans too. So listen, a lot of people don't have insurance out there. So I hope that answered the sensitivity question. If you want me to expound on that, please feel free to ask more questions. Dental insurance, that's a tricky game because it's not like medical, you just get, dental insurance can be tricky and dentistry can get really expensive. So we have like discount plans in our office where you sign up, you get free cleanings, discounts on all the procedures. So I have no, I know I get some criticism about the fact that I recommend implants so often, but the reality is implants are the closest thing you could get to nature. Yeah, you want me to give you a cheaper option? Sure, I can give you a cheaper option, but you're gonna know you're gonna be conscious of the fact of like you have a removable appliance in your mouth. And I hope those things go extinct one day, because I literally saw somebody yesterday and I'm like, the reason you're losing all your teeth is because those things, they rub all over your teeth. Oh, what are my my thoughts about Smile Direct Club? Implants look painful. Oh, thank you for asking that. Oh, Smile Direct Club, I literally already recorded a video about that. I'm gonna probably be releasing that on Sunday of who is a candidate for Smile Direct Club and who is not, because I am sorry to say, but they tell everyone they're a candidate. How can everyone be a candidate? You should be suspicious of that. I'm gonna cover that topic at length I like to release my videos on Sunday because I figure more people have more time to watch. On Sunday, I will definitely do that. And I missed the other question. What do you think about Smile Direct Club? I forgot the other question. I'm so sorry. So whoever you were who just put another question right after the last question, I would love for you to ask that question again. And feel free to comment on this one. Versus Invisalign. It's the same thing. It's the same thing. What's the difference between Smile Direct Club and Invisalign? It's the same thing. Don't let them fool you. Now the difference, cost, is a huge difference. But if you're going to do Invisalign, you're going to see a dentist, and that dentist is going to make sure you're cavity free, you're a candidate, you don't have any wisdom teeth that need to be pulled, you don't have any gum disease. Before they do it, Smile Direct Club is not going to do that for you. So you got to be careful with that. Now, it works. I'm not saying it doesn't work, but everything works as if you're a good candidate. If you're not a good candidate and it doesn't fit you, you're going to end up spending your money. You know, you can even spend your money on something that doesn't work. Somebody's asking about oil pulling. I got a video on that. It's really old, but oil pulling is safe. Man, how can you use coconut oil and it hurt you? I don't really understand why anybody's afraid to use coconut oil. I use coconut oil on my body all day, all the time. I use coconut oil on my lips, on my skin, on everything. Put it in your mouth. It's freaking fantastic. Sorry, am I allowed to say freaking? Oil pulling is awesome. You can use it with your braces. I mean, now with your retainer, you're going to get this really filmy residue, and it's going to be harder to clean. But I do encourage actually my patients to clean their oral appliances with a little bleach ever so often if you see my denture video, because bleach kills everything. Bleach kills everything. So if you're going to do oil pulling and you're going to have that, make sure that you're also cleaning your things so you don't get this filmy, yucky residue. I believe in dentistry. I believe in medicine. I believe in all that. But I 100% believe in natural products. Natural products are where it's at. If you can't get something from nature and use that, garlic, whatever, it works. It works. So oil pulling, but just don't forget the basics. If you're going to do something like that, you still have to brush. You still have to floss. Oh, that's the other question I missed. Somebody asked me about interdental brushing. I'm not really sure exactly. I'm trying to keep these videos to about 30 minutes so it's not so long, because I can talk forever and I have to go soon. But if you, sorry, I just lost my train of thought. If somebody wants to refresh my memory, I would really love that. I forgot. So if you want to ask that question again, I'd love it. Please forgive me. I'm like trying to get it all out, and because, interdental brushing, that's what I wanted to talk about. So interdental brushing, I'm not really sure what that person meant by that. Interdental brushing is flossing. So I actually have a video that I've already started to film about the toothbrush that I recommend, and I'll just give you the punchline right now. It's Oral-B. I love it, and they have floss action, they have all those things. Please, please, please do not believe these people who say if you do this you do not need to floss, because the reality is, I say test it for yourself. Go and brush and then floss. You're gonna find something, and if you don't find something, you're probably fine, right? I think there was a study out there that was talking about flossing and its non-necessity. The reality is a lot of people get away with a lot of things, and they get a lot of things. Oh, somebody was saying, I'm not sure if everybody can see the questions that come up besides me. I'm going to watch this video later so I can see. But I'll tell you a quick story. When I was in dental school, when I had my first implant done, and I know that sounds, I have 3 implants, okay? And if you watch any of my videos, you know that. I'm still in the process of restoring the last one. And I had a crazy amount of pain because when they extracted the tooth that was next to it, the tooth that was in front of it, the root is exposed, and that happens to me sometimes with my patients who have wisdom teeth. You're used to all this gum covering the tooth, you take it away, and now the root of the tooth that's in front of it is exposed. Oh my gosh, it was like, I don't know, January in Philadelphia, and I would go outside. I'm a Miami girl, just to let you know. They would go outside, I would go outside and literally breathe in, and it's like somebody took like an ice pick and like stabbed it in my head. That thing was so painful. Literally sometimes, even when I'm working on a patient, if I take their crown off and they don't have a root canal, and we're getting ready to put the permanent crown and they're in the room because we keep our office really cold, and they breathe in and that thing goes, oh my gosh, that is so painful. So, you know, having a cold area, you may not really have anything wrong with you, but because you're in a cold area, even healthy teeth feel sensitivity sometimes too. So not all of it. I say go to the dentist just to make sure. If you're a regular dentist going, they said, I don't have no cavities, I don't have any recession, you know, but you go out into that cold and thank you God, Florida is getting a little nice breeze. We're not cold at all. But if I have patients who work at Publix, and I don't know where everybody's from, but they work at Publix in the freezer, and they go in and they have, sorry, I guess when I get low battery, it goes down. They work in the freezer, and then they go nice and breeze. I know, right? We don't usually get this weather. We don't get this weather at all. I hope we actually have a winter this year. But having a cold is very difficult. So if no one has any other questions, I think, it's another funny question that I got. I know, I'm laughing too. Another funny question is where I'm from. I'm not going to reveal that yet. I feel like some people already know where I'm from. But the reason I'm not going to reveal that, of all the questions that I get, besides the fact that I look really young, and besides the fact that I don't look like what most people think a dentist should look like, and I'm so over that. Yes, implants. Now I remember the other question that someone asked, and I think that I'm going to make this, I cannot believe I've been talking for 25 minutes. I'm going to make this the last question. Are implants painful? Please, please, please watch my video about my dental implant experience. This is true. I'm not a scientist, but I do studies on all my patients, everybody that I see, and I place hundreds of implants. It was me. Thank you. If I place hundreds of implants a year, and everybody who comes for their post-op, I ask them, how much medication did you take? How much pain did you have after? And the theme is always the same. If you have a missing tooth already and I place an implant, the pain is so minimum, it's ridiculous. Like literally, it's surprising even to me, and I've been through it, how little pain that people have after a place, we call it edentulous, after a place that's already missing to place an implant. Nobody believes me until they actually go through it, and they're like, what? Now, when you have a tooth extracted at the same time as an implant, that is called an immediate implant. When you have a tooth extracted at the same time as an implant, you are going to have more pain, but it is not because of the implant. It is because we extracted a tooth, and that's where the pain, the trauma comes from that. So when I do an extraction, I tell somebody that was easy, you're gonna have less pain. Or I tell them that was more difficult, you're gonna have more pain. And even then, I don't know, it's so surprising. Of course, we give you pain medication, we give you antibiotics, we give you all of those sorts of things, and a hell of a lot of tips just to make sure that you're doing the right thing, because sometimes people cause themselves unnecessarily pain because they're messing with the area a little bit too much. You like my hair? Thank you. I have patients accuse me of being in the CIA because I change my hair all the time. All right, I'm gonna wrap it up. Thank you so much for being so interactive with me. This was like way better than I even thought. I hope that you share this message with other people, and please join me. I am going to try to make it on Tuesday afternoon, somewhere around this time, lunchtime-ish. Kids are at school, everybody's at work. I have a little time to sit down. I do work almost every day of the week. Oh, yay, Sunday's video. It's gonna be about, now I have a little bit more pressure on me, and that is great. So that I can make sure that I answer those questions about Smile Direct Club, because that thing is on fire, and I've literally had patients myself who have done Smile Direct Club unsuccessfully. Maybe I just haven't heard from the people who have done it successfully, but it's something that it's revolutionizing orthodontics. I'm pretty sure all the orthodontists are very mad and upset that this thing even exists. And every time we turn around, there's a new one coming out, which I think is kind of good. But at the same time, I just want to make sure people don't waste their money. Because then you're going to pay, I think the average cost of Smile Direct Club is like $2,000, which is a fraction of maybe the $5,000 you're going to pay with an orthodontist. Or even if it's only $1,500 left and they're doing it for $3,500 or something like that. But you want to make sure you get a result. You're not doing dentistry just to get no result. If you waited all of this time to straighten your teeth, you want to get results. You want to close your gaps the right way. So make sure you're not spending time and money on something that's not going to work. So I'm going to make sure we get those videos out to you. Please, please, please give me your feedback. Let me know the things that you wanted me to discuss. These are just a quick comments that I get to say with you guys, but it also gives me a chance to interact. Man, this is so exciting. Oh, somebody says they need a root canal, but they don't have the money. And I'm going to answer this in the 1 minute that I have left, and then I have to go. So if you need a root canal, but you don't have the money, ask your dentist if they can do it in steps, okay? So, and I have an orthodontist video about this. I mean, endo video about this, and I may have to expound this a little bit more. This is what I do for my patients. It literally pains me to pull a tooth that I think can be saved sometimes. So a lot of patients, they don't have money. Listen, I'm not in an area where everybody's just like handing out the cash. Sometimes they need to be payment plans and stuff like that. And so what I tell them is do the pulpectomy. Pulpectomy means we take the nerve out of the tooth. You're going to feel better that day. Then after you take the nerve out of the tooth, you come back, finish the root canal, pay the next part. Then after you're done with that, put the filling on top. Then after you're done with that, start the crown. Then after you're done with that, do the crown. So then you still get to keep your tooth, but it spaces it out in a way that you get to the immediate result of not being in pain from the beginning, and you don't have the result of pulling the tooth, because obviously I love implants and I talk about them all day, but keep your tooth if you can. You know, keep your tooth if you can, and if you cannot afford to do so, if you pull it, you're gonna pay way more money in the future. And not only that, you're going to have to deal with all the results of having a tooth pulled that's going to shift your teeth, that's going to cause excessive problems that you don't need. And if you start to like focus on it, and this is where the young people versus the old people in my office have a difference. Young people are so quick to pull it. Oh, I got the money, I'm going to go on. And guess what the old people are all doing? All the people in their 70s, they want their teeth back. They want to eat. And they can't eat without teeth in the back. Believe me, I'm telling you from experience. I love food. I want to enjoy it. And if I can't chew on this side because I'm missing, I can't chew on that side, it makes a huge difference. And once you have teeth missing, you don't know what it feels like to have it gone. So make that's irreversible, pulling a tooth. So once you have a tooth taken out, you're not going to put it back and reimplant it. But at least, let's say you did the pulpectomy, you took the nerve out, and later on you said, you know what, I can't do this. I have to pull the tooth. At least you have the opportunity. Yes, I know. At least you have the opportunity to change your mind, but give yourself some time. I don't like when people make decisions when they're in pain. It's really difficult for you. You're sitting in a dental office, you're like, you know, you're in so much pain, maybe you haven't been sleeping, and then you go and you pull the tooth, and then later on you're like, what on earth am I thinking? Everybody, I always tell patients, I'm like, you're gonna say, that's the girl that pulled my tooth years from now, as opposed to, that's the girl who helped me save my tooth. Give me 10, 15 more years left. How can I be mad? Do you know what I mean? But you'll always regret pulling the tooth, unless it's a wisdom tooth. Get rid of that sucker. You guys are freaking awesome. Love you guys. Have a wonderful rest of your Tuesday. I look forward to interacting with you guys on Sunday. If you don't follow on Instagram, it's Modern Smile CS. I post things there all the time, but this informative, bigger platform is where it's a little bit. Thank you for interacting. Thank you for encouraging me. Thank you for welcoming me back. I appreciate all of that. And all of that actually spurs me on into doing this some more. All right. I hope you guys have a great day. Thank you. Bye-bye.